Hi guys, I'm Allie. For our Microteach, we are doing prevention of infection in the elderly population.
Hi, I'm Jessica. I'm a student nurse. I will be discharging patient Myrtle. She came in for an infection yesterday on the 27th. She'll be going home. All right, the number one way of preventing infection, hand hygiene. Yes.
Hi.
Myrtle?
Yes.
I have your discharge papers ready. You ready to go home today?
Yeah.
Okay. So, there's a few things I need to talk to you about. While you're doing a lot, here's all your paperwork. While you're doing a lot better, it's important to finish the antibiotics that we're giving you, that you're going to be taking, okay? This is to prevent the possibility of resistant strains, and even if you feel better, continue to take them.
Why?
To prevent resistant infections.
Okay.
Okay. All right. Also, let me see. It's important to make sure that you're up to date on your vaccines. This is including the Pneumovax, which you only need once in a lifetime if you got it after the age 65. We gave it to you today, so you're good. The flu shot annually. And the shingles shot is just once, okay?
Okay. And I got those too, right?
Yes. And tetanus. You need that one every 10 years. You couldn't remember, so the doctor decided to give it to you.
Okay.
So, and we'll have it documented, okay?
Okay. So I'm safe.
You're good to go, yeah. So, then also, something to keep in mind is signs of infections. Normally, we all think about fevers, chills, and just feeling bad. But in the geriatrics population, it may present itself as signs of weakness, confusion, and delirium. Did you catch that, Betty?
What's a geriatrics population?
Above 65.
Oh, so just old ladies.
Yeah.
Oh, oh sorry, Mom.
Nice, Betty. So, anyways, so those are signs. If she starts presenting those signs, confusion, you know, you might need to call a doctor, okay, or bring her back.
Okay.
It's important to maintain a healthy diet, adequate protein, limit caffeine, and try to stay away from alcohol.
I can still have my coffee.
Yeah, you can still have it, just don't overdo it. Let's see. Also, because your immune system's a little weaker, it's good to say no to sick visitors. Okay? Sick grandkids, you might want to wait till they get better, okay? Also, Myrtle, we made you an appointment with your primary care physician, okay? You have an appointment in 1 week next Tuesday at 1 p.m.
But it's really hard for me to go to the doctor. Can't he come to me?
We can call the office and see.
Okay.
Okay, does he normally come and visit you?
Yeah.
Okay.
And home health? Am I getting home health?
Yes, you will be getting home health.
Okay.
Okay. Social services will come and talk to you about that. Okay? So when you go see your doctor, it's important to review your medications because we added a few, especially the antibiotics, okay? Advocate for yourself when you're with your doctor. Ask questions, okay? So this is a list of all your things that you have. Make sure that you're going to take them home.
Okay.
And if it's right, sign there, okay? and the CNA will bring in a wheelchair and get you guys out of here.
So my glasses, my book. Do you have my book?
What book?
The book I had here.
Oh.
Nothing's in the drawers.
Did you take it home already?
I think I did.
Okay. So, yeah, I have everything.
Okay,
Do you have a pen?
just sign there. All right, and I'll leave these papers with you on education and your medication.
Megan, I am the home health nurse, and I'm coming to visit Myrtle and her daughter. So they're in the garden, so let's go take a look. Hi Myrtle. Hi Betty. How are we doing?
Okay.
Feeling better?
I don't know.
Is there any issues you'd like to talk about?
I don't know. I don't think she's been feeling really good lately.
She still hasn't. And have you finished the medication? The antibiotics that were prescribed?
No, I felt good, so I stopped.
Okay, so the importance of taking the antibiotics is even if you do feel better, you need to still keep taking it because you can develop resistant strains of bacteria, and it can actually make it worse for the if you were to get sick again. So we definitely need to keep taking our medications as prescribed by the doctor and not stop taking anything unless we consult our doctor first.
Do I have to start it again?
That would be great. It's also something you can talk about with your doctor. I understand you have an appointment in a couple days.
Mm-hmm.
Okay.
So you know the water pill that the doctor was giving her?
The Lasix?
Yeah, she hasn't been taking that anymore because when she takes it, she wants to pee all the time, and then I have to keep changing her sheets, and I just don't want to do that anymore.
Okay. So again, just like with the antibiotics, if the doctor has something prescribed, you definitely want to take it as prescribed and not stop unless you speak to your doctor.
I don't want to pee all the time. I'd rather just lay down.
Okay, so part of peeing, you're kind of flushing everything out of your system. And there's a couple of things we can try in order to help. For example, Kegel exercises are really good at helping with incontinence. And so have you been practicing your Kegel exercises?
No.
Okay, do you know what Kegel exercises are?
I think so. They're kind of naughty.
You know, it's a natural occurrence in the body. So peeing is totally natural. And I do notice that we have a little irritation right here.
Break down.
we do have
Stuff at skin breakdown.
breakdown. Have a little skin breakdown right here. I don't recall seeing that in your chart as leaving the hospital. So have you noticed when this started?
A couple of days ago.
A couple of days ago?
Yeah, because I moved myself up in bed with my elbows.
Okay, have you been staying in bed a lot?
Yeah.
She stays in bed all day because really, if you saw how hard it is to get her out of bed, you would totally understand.
And I hurt all the time.
Okay, so there's
It's
actually
started getting old.
Well, there's some things that we can do that can help with your joints. You can try getting a warm washcloth or a warm towel and putting them on your joints, your hands, or your elbows and your knees. You can do that in the morning to help loosen them up. There's also some exercises you can do in your bed before you even get up, and that can help loosen you up to make it easier for you to get out of bed. Okay, so you can just put your arms over your head. You can put your arms across your body. You can lift your knee to your chest and just do it until you don't want to do it till you have pain, but you just want to get a little bit of a stretch in, and that'll help you get out of bed. There's also some exercises such as yoga and Tai Chi. I don't know if
I don't like to exercise. It hurts.
Okay, so they're both very low impact, and I can actually teach you some Tai Chi movements. And since you have this beautiful lake out here in your backyard, it'll be a nice exercise for you to do, and you'll also get the benefits of being out in the fresh air.
Okay.
Okay.
Is that going to help with my infection?
Exercises do have a positive impact on your immunity. They help, it aids in your respiratory, your circulatory, your digestive, and musculoskeletal functions. It'll also increase your appetite and help with your sleep. I don't know if you've been having some problems with your sleep lately?
I can sleep all the time.
Okay. Another perk for exercises such as Tai Chi, it improves your flexibility and balance, and studies have shown that it reduces falls by 25%. So I know you're saying it's kind of hard to get her out.
You know what? I have some rugs that I put all over the floor because then if she falls, then she's got cushion there for
Yeah,
her.
I did notice those when I came in. Those actually kind of make it worse because they're tripping hazards. So if we remove those rugs,
I'm not trying to trip you.
if we remove those rugs, it might make it easier for her to walk around and get around in the house. Okay, so it seems like we might be under some sort of stress, I take it. Stress actually reduces, it increases our serum cortisol in our body, and that reduces our, it's an immunosuppressant, so it reduces our body's ability to fight infections. So along with the exercise and the Tai Chi and being outside, those are really great stress relievers. You can do some deep breathing exercises as well. And it is said laughter is a really good immunity booster as well.
Make me laugh.
I'm not a comedian.
You can watch some comedic shows. I don't know if you have, you can watch some I Love Lucy on TV. I know she always made me laugh. If there's any of your favorite comedy shows, laughter also helps with our respiratory tract. It helps increase our heart rate, and all of that helps with our immunity as well.
Okay.
How's our diet? How have you been eating?
Frozen dinners.
Okay, so our diet is also extremely important to our immunity. So you really want to get some nice protein in there. You can get some eggs, some meat, beans, legumes, yogurt, non-fat cheeses, some fresh fruits and vegetables. Do you have access to all of that?
Can you go shopping?
I have to go to the grocery store.
Okay, yeah, all of that is really great for her immunity. You can also take a multivitamin with mineral supplement. I don't know if you like garlic, but garlic is also really good for, it's got antibacterial and antifungal properties, which will also help boost your immune system. You want to limit your intake of refined carbohydrates, so try white breads, maybe get some whole wheat bread instead. You want to limit your caffeine and alcohol intake.
But I like caffeine. I like my coffee.
Who doesn't like coffee, right? It's really good in the morning.
I can still have my coffee?
You can still have it. We just want to keep it in moderation.
Okay.
She likes to drink it all day long.
Maybe we can just
Telling me.
we can slowly reduce our caffeine intake, our coffee intake, maybe drink some more water instead, because again, that'll help clean out our system, okay?
Okay. Water? Really?
Water is very good for the body.
Okay.
So would you like to try some Tai Chi?
Yes.
Okay. Okay, so Tai Chi is very low impact. It's really good for your joints. It improves flexibility and balance.
Do we get to do karate kicks?
No. But, you know, you can take a karate class and do karate if you would like. So what we're going to do is we're going to have our feet just a little bit apart. And then it's also really good for deep breathing. So we're going to take a deep breath in and raise our arms. And then let your breath go and put your hands down. So now we're going to move our arm across our body. And we're going to face this direction. Move your foot. Make sure you keep your balance, okay? And then we're going to take a step this direction with our left foot forward, okay? And move our arm across our body as we do it. And then now we're going to put our hands together and we're going to take a step towards Betty, okay? You doing okay? Mm-hmm. All right, and take a step towards Betty. Move your arms forward. Now move your arms up and back. Now forward again. Up, back, and forward again. Okay, now how does that feel?
Good.
You feel good?
I like that.
Okay, so
I
you
can
can
do this kind of exercise.
yeah, see, it's not really hard on your joints. Just make sure you keep control of your breathing.